Hello everyone, my name is Madison Rives, and I am a senior at Wayne State University, where I am majoring in public health with a minor in health psychology. I had the privilege of interning with HAND, the Homeless Action Network of Detroit, this semester from September through December of 2024. And in this presentation, I will be providing an overview of the work that I have done during my internship. Let's get started. Starting off in September, I completed my LMS training and my CAM 101 training. I also participated in my internship orientation, and my first official assignment was the October Bulletin Staff Board. So I completed that. I also viewed relevant materials on HAND, and I also assisted with the in-office purging to help organize the workspace for our move we made in October. In October, I attended the CAM governance meetings as well as the COC board meeting. I was introduced to the social media team and participated in a PSH letter of support meeting. I also worked on a racial equity assignment. In November, I focused on engaging in CAM check-in meetings, and I also started creating my own social media posts. I conducted research on how other COCs manage their LIHTC processes, which means low housing income tax credit, and I completed a DEI assignment. I also attended governance charters meetings, and in December, I finalized all of my tasks, including my social media posts, and I also finished my January bulletin staff board, and I also worked on my exit materials to conclude my internship. During my internship, I created social media content and designed 2 staff bulletin boards. I had the freedom to explore a variety of topics for my social media posts, which were always published bi-weekly on Tuesdays. My content addressed critical issues, such as how DEI affects homelessness, which offered insights on diversity, equity, and inclusion, as well as seasonal topics like preparing for winter, how you can help, which focused on resources and support for vulnerable populations during the colder months. I also created posts about the holidays, bringing attention to resources available for families. For the staff bulletin boards, I designed them based on the themes of each month. For October, I highlighted Domestic Violence Awareness Month and Breast Cancer Awareness Month. And for January, I created a bulletin board that focused on new beginnings. Another task that was given to me throughout my internship was to complete a DEI assignment that required me to develop 2 scenarios for each of the themes of diversity, equity, and inclusion. One of these scenarios included a personal example, which allowed me to reflect on my own personal experiences. I also wrote a paper on health equity, which emphasized the importance of surveys, especially those that collect demographic data on race and ethnicity. The paper explored how such data is crucial for identifying and addressing racial inequities in various sectors, including healthcare, education, housing, and criminal justice. Throughout the semester, I also attended multiple meetings each week. These were CAM governance meetings, the COC board meetings, CAM check-in meetings, and the PSH letter of support committee meetings. My primary responsibility during these meetings was to actively listen and identify key points of importance. This involved summarizing critical updates, decisions, and action items, as well as noting any follow-ups that were required. My most memorable moment at HAND was attending my very first COC board meeting back in September. It was my first in-person meeting since joining HAND, and it was a great opportunity for me to meet many of the people I would later work closely with. The experience was both exciting and nerve-wracking. It gave me a deeper understanding of the collaborative environment at hand and the important role each individual plays in the organization. The most advanced project during my internship with HAND was the COC County Task Assignment. My task was to gather and analyze information about how other COCs from different counties handle their process of LIHTC, Low Housing Income Tax Credit. One of the biggest challenges I faced was finding the correct and up-to-date information. Many of the resources I was seeking were either difficult to access, not clearly labeled, or very out of date. Throughout my time at HAND, I completed a total of 122 hours. Before working with HAND, my perspective on homelessness was more generalized, but I still understood it as a significant social issue. Through my internship, I gained a deeper understanding of the complexities surrounding homelessness, including mental health challenges, lack of affordable housing, and systemic inequalities. This experience with HAND broadened my perspective by highlighting the structural barriers people face in accessing stable housing, employment, and healthcare. While I remain passionate about public health, after graduation, I plan to pursue a career as an X-ray technologist, combining my interest in healthcare with technical skills to directly impact patients' lives. This is my updated resume, and my contact information is in the top left corner of my resume. I would like to sincerely thank HAND for giving me the opportunity to be a part of this impactful organization. This experience has been invaluable in broadening my understanding of homelessness and the systemic challenges many individuals face. I am deeply grateful for the knowledge that I have gained, the skills that I have developed, and the meaningful work that I have been able to contribute to during my time here. Thank you for allowing me to grow both personally and professionally while supporting HAND's mission, which is to provide leadership to end homelessness. Thank you.